Well, I'm Richard Evans, I'm the Chief Executive Officer of the Society and College of Radiographers, and I'm here today in the Pullman Hotel in the Euston Road in London, where we're holding the 5th National Conference for Radiology Managers. This is a collaboration that we run with Philips, the healthcare equipment manufacturers. They manufacture many things, of course, Philips, but this is their healthcare division, and it's a collaboration which really works for us because it allows us to meet those people that are managing the services that our members are involved in delivering day by day.
Oh, I think they're fantastic. They're absolutely fantastic. And when we had no forum originally for managers to get together to explore common themes and to actually learn from one another. So yeah, it's been really great.
The buzz in the room is extraordinary. As around 300 managers get together, it's a bit like a reunion. It's a great opportunity to catch up with people, but also to meet new people, to find out how they're managing the stresses and strains in their own services, to pick up some good ideas which you can take back and use for improving services to patients, improving the workforce experience for our members, their colleagues, and of course to make life more bearable for the managers themselves, because it is one of the most highly pressured areas of the workforce at the moment.
I found the first talk on human error very, very good. I thought it was very interesting about how mistakes happen, because we shouldn't be working in a blame culture.
Quality matters, safety matters, patients matter. And it's really important from our perspective in CQC that we consider these elements and consider not just that they matter, but actually that we're following through.
I've been to all 5 actually, and they get increasingly more interesting as you come. It's a great place to come. The difficulty with being a radiology manager is we don't get around to meet each other. And sometimes a problem shared, and certainly a problem aired, works really well. And I find here the loneliness of command that you get back at work is shared. And I'm picking up so many ideas. I'll go home, I'll be buzzing. I won't need a gin and tonic. I'll be happy of having had this.
I'm Tim Cooper, I'm Head of Hospital Inspection for the Care Quality Commission. My role is to lead inspections to acute hospitals across the country, and essentially in the inspections that we lead, we want to look at whether services are providing safe, high quality, effective care to patients.
And what we want to see is that services this year that are outstanding are only good in 5 years' time. Those services that are good now and don't do anything for the next 5 years will be required improvements in 5 years' time, because that's about driving up the standards of care.
So I've met quite a number of people who both welcome the CQC visits because it's a difficult process, and people don't like being on show and they don't like being tested in that way. It's an uncomfortable process, of course it is. But those people who have been through it see it as a great opportunity to showcase what they're good at and to understand where their challenges still remain. So we start by looking for good, and therefore people are very proud to show what they're good at. We've had a really positive response from radiographers who want to come and join our visits. We've had a positive response from people who want to be part of an inspection team, because for them it's also a learning opportunity. Go and see somebody else's service, learn from what they're doing, use it as an opportunity to improve what you do and bring some ideas back to your service, make some contacts, but also contribute to somebody else's success and development.
We had a debate which was extremely entertaining. The idea of the debate is to have an entertaining exchange of views. It was about whether there is any more cost that can be taken out of radiology at the moment, or whether actually we've achieved, or managers have achieved, just about as many cost savings as they can. So the motion is there is no further capacity in radiology for cost saving. The best thing about the debate, however, was the fact that it opened up a lot of discussion in the audience, because it's a great way of getting people focused on the subject, talking about their own experiences, asking further questions, the questions they want to be put to the panel. So I was very pleased with the way it went.
I was surprised to see before the debate that yes, they did. I was surprised. I actually thought most people would say no, there is no more. So be interesting to see when we get back whether we've changed our mind.
I can see both sides of the coin. I'm with the we could probably squeeze a little bit more out of the Stone Club. But then there are interprofessional tensions, as always, and I think if we can get those addressed, we'll find that there's a little bit more wriggle room for us.
Oh, I'm on the true side. No more cutting our funds. In fact, I think there should be a huge investment into diagnostics with the introduction of the new cancer pathways. Equipment needs renewing, and it's all very well saying that we can work longer, sweat the assets more, but you need radiographers to do that, and there just aren't the radiographers or radiologists in the system to cope with it.
I was very surprised with the original assessment of which way it was heading in terms of the vote, because I thought we have a very tough job being independent sector, saying the NHS can save money. We thought we have but if it goes the way we hope, I think there is a realisation that there can be money saved within radiology. I think there's a realisation you can save money.
We can all be professionals today, tomorrow we can be patients. So we've got a professional responsibility to work with our colleagues beyond radiology.
What can we learn from the flight industry? Oh my goodness, that was a fantastic talk, fantastic. And I think, yes, again, why aren't we looking outside of the NHS to see what else is out there, good practice? I think there's lots we can learn. And obviously we've been through ISAS accreditation, we've been through a recent CQC inspection, so listening to those two talks as well resonated. I could feel it all, so really good.
There may well be a few people that have changed their minds since they had the straw poll up first.
I actually voted. I do believe there's more that we can do. And that's because I don't think you ever stop innovating, improving, becoming more efficient. I think if you do, you're complacent. And I think ISAS teaches you that a little bit. That you need to keep on challenging yourself, looking at ways of doing things differently. So I don't think I could ever say no more, ever.
When you vote, consider the context of, if you do nothing, if you say it's not possible, do you believe that a politician is going to give you money to pay for new equipment and make the clock stop for the next 3 to 5 to 8 years to get people trained up to deliver the service?
This is a great conference. All the feedback we get is really positive. And I'd just like to say a personal thanks to all the people involved in putting this great event on. The 5th time that we've done it, it goes from strength to strength every year. So thank you.
I think sharing of ideas is important and sharing experiences is important, because from sharing those experiences you can learn from them and you can build on them. Teamwork and sticking together makes anything possible.
You've got nearly 300 managers here and radiographers and radiologists. It's a fantastic networking meeting. I think it's great about sharing experiences. And you can see that this morning, some of the talks this morning, superb quality talks, stimulates a lot of debate amongst the audience. So it's just that opportunity to meet with colleagues is superb.